Dr. Ailawadhi, what are the most significant challenges or barriers that patients with relapsed refractory myeloma face when considering CAR T cell therapy as a treatment option? And how can these challenges be addressed to improve patient outcomes and access to care?
Lisa, it's very important for us to remember that while we talk about CAR T or advancements in myeloma, your question of what are the most significant challenges and barriers for patients with relapsed refractory myeloma, and especially when they're considering CAR T and how do we try to overcome these challenges, this is a very important question. CAR T cell therapy is very resource and time-intensive treatment. Patients may not have a CAR T center close to them. They may have to go closer to a center, live there for about a month or so, or sometimes even more. During this time, the treatment has to be controlled. There are approvals from insurance. There are tests required in between treatment to control the disease. And then sometimes staying in the hospital, sometimes, and of course, need for a caregiver. That is such an important requirement. Of course, the promise of treatment is that at the end of it, the patients may come out and maybe with significant disease control. But to get to that promised land, we have to walk through this kind of, as I said, a time-intensive and a resource-intensive situation. Now, all of this is very daunting, is very anxiety-provoking, is very scary, in fact. To me, the biggest way of overcoming these challenges, improving access to care, etc., is let that patient see a qualified CAR T cell center, and importantly, a physician who gives CAR T cell therapy. That one consult or one visit can take care of so many fears, anxieties, scares, etc., because frankly, all of our centers, all of us who focus on CAR T cell therapy, we have a whole slew of resources at our disposal, which we can bring together for the patients and their caregivers, whether it's navigators, revenue or finance analysts, social workers, clinical psychologists. These are all a part and parcel of our CAR T cell journey for a patient. But frankly, I cannot bring those resources to a patient when they're not even established with us or they don't even set foot through our doors. So my activation tip for this question is the number one way of mitigating any healthcare access issues or the fears and scares about CAR T is speak with a CAR T designated expert at a center that gives CAR T cell therapy, and then only take a decision whether you want CAR T therapy for yourself or your loved one or not.
One quick question. Are you still seeing the bottlenecks for CAR T therapy since it's been FDA approved? You have patients who want it but cannot access it because there's a bottleneck with the process. Is that a barrier?
It's a good question. So in recent months, we have noticed that the initial bottleneck with availability of slots and numbers for CAR T, those bottlenecks are easing up quite a bit. So with both the CAR T manufacturers in the US, there is hardly any wait list issue. And if patients are going to centers that are saying that, oh, there's too long of a wait list, we can't get you to it, they should go to another center.